Hey, I'm Dr. Isabel Rosenthal, and I'm a trauma psychiatrist. I want to talk to everyone about why we should care about PTSD as women. PTSD is actually a women's health issue. This little known fact is sometimes disguised by the fact that as a society, we tend to think of PTSD and veterans, and we tend to not include women when we think about trauma. Unfortunately, this happens to women in so many areas of healthcare. Most trauma that happens in this country does not happen in battlefields, but actually happens at home with friends at parties. Women are actually twice as likely to experience PTSD and trauma. And often they're suffering from traumatic events such as sexual assault, domestic violence, and rape. As a society, we tend to discount these experiences on the bodies of women. But it is so important to know about them because they can lead to symptoms of post-traumatic stress disorder. So, what is PTSD? PTSD can sometimes be confusing because it can look like other things. Patients with PTSD can show up with depressed mood, and sometimes people think it's depression. They can show symptoms of anxiety that gets misdiagnosed as generalized anxiety disorder, or they can even seem inattentive like a patient with ADHD. But there are other symptoms to be aware of as well. A common symptom in PTSD is avoidance, both physical and psychological, meaning that you do your best to either not think about the event or actually to physically avoid the event. And this is often linked to intrusive thoughts that people have about the trauma, where you're trying not to think about what happened, but these thoughts just come in and out of your brain. There also are famously other symptoms such as flashbacks, memories of the event that you don't want to think about that feel real, unlike intrusive thoughts, nightmares. It is so important to be on the lookout for these symptoms after you suffered a traumatic event because PTSD is not a lifelong illness. People can recover from it. And the best treatments we have today are actually our evidence-based psychotherapies, which we'll talk about more in another video. But these treatments include therapies such as cognitive processing therapy, prolonged exposure, and second-line treatments such as EMDR and written exposure treatment. Women often get neglected in our US healthcare system. Let's not let PTSD be another reason women are not taken care of in our system today.